pile of sticky notes which contains antiemetics and certain ulceroprotective agents. So the points which I have written here are very high yielding, so keep that in note. So let's continue the video. Yes, first, anti-cancer induced or radiation induced vomiting. The best agent or antiemetic given here is 5-HT3 antagonist. So these are nothing but cetron drugs. Cisplatin is the most common anti-cancerous drug which causes vomiting. So the better treatment which has been given for those patient who are taking anti-cancerous drug is 5-HT3 antagonist. So ondansetron given, granisetron given, tropisetron given, dolasetron given, so palanosetron. Of this, the most common side effect of ondansetron, it's nothing but emetics. So it is the most commonly used name for ondansetron. So the side effect is headache. For dolasetron, the side effect is QT prolongation. For palanosetron, there is no important side effect, but it has a very highly selective action. So the T half is for 40 hours. So it is used as a treatment for delayed vomiting. So better efficacy for the anti-cancerous drug induced vomiting is to combine these drugs with D2 blocker or benzodiazepine, or add some steroids like dexamethasone or methylprednisolone. The second group, also cannabinoids. Cannabinoids like nabilone, dronabinol, both are used as antiemetic plus appetite stimulating agent. Okay, so obviously while taking cannabinoids there will be conjunctival congestion. So the eye will be like bloodshot eye. So it is a keyword for the patient appearance on taking cannabinoids. For the late phase vomiting, we can use NK1 antagonist like aprepitat, fosaprepitat, rolapitat and newtopitat. Antipsychotic agent like olanzapine also effective as antiemetic drug. So it has extra action like functioning as an antiemetic. So the antiemetic comes to an end. We can see about antihistamines. So H2 antihistamines. So as I have said before, cimetidine is a drug which causes gynecomastia and it is also a microsomal enzyme inhibitor. So it is the very least potent drug among various other antihistamines. And ranitidine. Ranitidine is the most commonly used drug, and famotidine is the most potent drug. Least potent drug, cimetidine. Most potent drug, famotidine. Nizatidine. Nizatidine has an additional property of having anti-acetylcholinesterase activity, and it has very much 100% bioavailability. So there is a non-competitive inhibitor, which is nothing but loxapine. So all these are most effective at night, and all these have a renal excretion. One additional drug, lafutidine. Lafutidine is very much given for ulcer healing because it has a nitric oxide increasing property. So nitric oxide is produced, there will be a vasodilation. So there will be an increased mucus production. So all these held up together and promotes ulcer healing in that area. There will be also, and yes, we can see about prazoles. Prazoles are nothing but PPI, proton pump inhibitors. So they have the mechanism of action by inhibiting the proton pumps through hit and run mechanism. So which is an irreversible phenomena. So that even though the T half is less than 2 hours, there will be a longer action. So it is metabolized by cytochrome 2C19 and cytochrome 3A4. So the cytochrome 2C19, it is followed by omeprazoles. So omeprazole and clopidogrel should not be given together. That's the takeaway point. So the prazoles are used as a drug of choice for Zollinger-Ellison syndrome, GERD, stress ulcer, and NSAID-induced ulcer. So the side effect will be vitamin B12 deficiency, GI infection, increased onset of hip fracture, and pneumonia. So the drugs among the PPI which are safe in pregnancy are pantoprazole, rabiprazole. Rabiprazole has a faster action. So both these drugs have no drug interaction. So the drugs having a T-half of 9 hours are tenetoprazole, elaprazole. Then the other drugs, Vanopraxer, Revafraxin. So these drugs has an additional property of potassium channel blocking property, which is nothing but a competitive inhibition of potassium channel along with proton pump inhibition. So these two drugs has faster acid suppression. Then M1 selective blocker, pyrazipine, telanzipine. These two can be used for the treatment of gastric ulcer. So that's it, guys. I have covered nearly 6 sticky notes. Please subscribe to the channel. So like this video. Thank you, guys.